Hello, everyone. Hello, everyone, and welcome to this audio podcast. This audio podcast, as part of a research and presentation series. This audio podcast is part of a sort of a research and presentation, sort of edition, and this audio podcast as part of a ZtormLabostix production. Today, we'll look at works, peer-reviewed and published works from 2021, looking at education empowerment and sort of a practice review, and where this works was a sort of a practice review publication and a collaborative between several collaborators. And so this audio podcast or this overview will look at look at healthcare education, look at aims and objectives, look at a literature review, look at challenges across integrative practice, and look at implications to practice, and discussion, conclusion, and then there will be a reference or citation on the in the end slide, or on the end slide. So to begin with, tech advances, including use of social media, have allowed patients with long-standing conditions to access supplementary information regarding health and disease through a range of resources, including the RPSG, or the Renal Patient Support Group, respectively. However, online information is at the same time vast, and much of it can be daunting, leading to misinformation, and patients with long-standing conditions still require involvement, and this is principal. Support for patients or healthcare service users from professionals or healthcare professionals can be multifaceted. Therefore, where patients or healthcare service users would normally see more than where patients would normally see, or healthcare service users would normally may see more than one or two healthcare professionals from the multidisciplinary team, or MDTs, for an aspect of care. Patients may find it advantage to schedule time with allied health professionals, or AHPs, who can provide remote education or educational services. Of course, any healthcare service provision provided would require documenting and transfer of information between electronic patient records, or EPRs, and also social media, and would need to be GDPR compliant. So looking at healthcare education, patients want more face-to-face understanding of lab investigations, or at least have healthcare professionals be part of online platforms where there is opportunity to develop practices. So by encouraging best practices regarding lab investigations that surround CKD, for example, this would also increase provision and improve population. Patient access to lab investigation through EPRs, through electronic patient records alone, is hindered to meet all today's patient care needs. Involving patient and professionals would be a sort of progressive proposition, where it can prompt a shared decision making, and electronic patient records could be updated with smarter infrastructure to integrate discussions through social media to enhance experiences. Security and reliable connectivity maintained within the National Health Service for example, would be pivotal, and this would allow faster transfer of information so that NHS services are bridged between clinical appointments and in keeping with additional healthcare services, for example, through app tech, and this in effect should empower patients. Now looking at sort of the aims and objectives, so this overview seeks to highlight whether it would be advantageous to involve patients together with healthcare professionals in multidisciplinary teams, in MDTs, through online consultations and or educational meetings. This overview also seeks to understand if it would be helpful to have follow-up online consultations with MDTs for healthcare following routine appointments. So looking at some of the literature review, clinicians report that consultations with some patients have changed because of patients' access to electronic patient records, EPRs. Telemedicine has also been reported as having advantages, usually described as home telehealth, telehome care, or home-based e-health. And the aim of telecare ultimately is to increase patients' independence and quality of life. At the same time, prompt collaborative and team working between patient and health professionals. In some works, one team focused on dialysis education, where several modalities of education were evaluated. This included face-to-face education and e-relating learning and e-relating learning, and the endpoint was a patient's ability to select the form of KRT. Three assessment tools were utilized to compare cohorts, including one, CKD knowledge, two, healthcare literacy, and three, quality of life. The study was undertaken wherein 240 consented to take part. The team highlighted patients want to be educated earlier, irrespective of face-to-face or online modality. Education is required to support CKD patients, especially around treatment options. Now looking at sort of challenges, sort of some of the challenges across integrative practice. So efforts through clinical care groups is or has focused on making small but marginal service changes for which the effort involved not for which the effort involved not always linked is not always linked to enhanced services or smarter patient care. Services for patients with long-standing conditions are not easily commodified within a purchaser-provider market, and these services are provided over months and years by a range of organizations and professionals, and it is hard to split them into single episodes. Access through electronic patient records, EPRs, have several advantages, but patient enthusiasm and use have been variable. The more successful systems have provided information that patients or relatives require, usually in the setting of usually in the setting of chronic disease or emergency. And so evidence also indicates a sort of a digital divide. So looking at implications to practice. So electronic patient records or EPRs, tech and or online portals have prompted at least 1 day faster service for patients to receive laboratory results or investigations electronically, a reduced sort of reduced error rate introduced during data entries, a reduction in ad hoc patient inquiries since information can be checked online, an increase in smarter commissioning decisions, and advanced opportunities for collaboration between patients and healthcare professionals. So now looking at sort of the discussion, the understanding surrounding lab investigations by a mix of healthcare professionals can lead to misinformation because CKD patients because CKD patients because CKD patients see nurses, nephrologists, and or general practitioners. One mixed method investigation informs online portals are not currently designed to present data in an expressive way. However, online spaces like that of the RPSG prompt involvement from patients and professionals to support healthcare practices. Now looking at the sort of conclusion, so tech is integrated into everyday life, and so it is important to have at the same time online spaces in the care for CKD patients. For example, patients with long-standing conditions are increasingly using the internet and smartphone apps. However, it must not be presumed that all LTC or long-standing condition patients can interact with aspects of tech online spaces or healthcare. For best practice to be achieved, patients and professionals should be co-developing efforts to preclude isolative healthcare practices. And so this slide now just provides the overall reference or citation for this works, and listeners and viewers are more than welcome to look to access this publication, which outlines the full aspects of this works. That draws this audio podcast to a close. This audio podcast is part of a research and presentation series. This audio podcast as part of a ZtormLabostix production. Thank you.